Talkshow. Let's learn together and grow. And today it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr. Priya Kumar, who is present here with us, and she will be answering some of our questions regarding today's topic, which is HPV. So, doctor, before jumping to the questions directly, please tell our viewers something about yourself.
Thank you very much, Priya and Narikaa Health Show. So, I am Dr. Priya Kumar. I am chairperson of Gynecologic Oncology Committee of FOXI from 2021 to 2025. Also, I happen to be the medical director of Sai Nivas Preventive Gynae Oncology Centers, Pan India. And this has been my pleasure to be with Narikaa Health Show.
Alright, doctor. So, doctor, what moment would you say was the moment when you decided to become a doctor?
So the Eureka moment would be when I was in 12th and I thought that I can't be anything much better than a doctor. And that's what even my family thought, whereas I was all under impression of becoming an engineer. But of course, I'm very thankful to my family who really helped me to select my branch. And in when I joined the course of MBBS first year itself, I thought I can't become anything else than a gynecologist.
Alright, thank you, doctor. So, doctor, as the topic itself says HPV, so doctor, our very first question for our viewers is what exactly is HPV?
HPV is a human papillomavirus. It's I'll say it's a common virus, and this virus has got multiple strains, as a low risk strains and high risk strains. A total of 150 or odd strains have been identified so far.
Okay, doctor. And doctor, is HPV dangerous?
HPV is actually not dangerous, as I told you. The virus has two strains, two risks, So there is a low risk strains and then high risk strains. Now the high risk strains are the strains around 13 or 14 high risk strains are found of HPV. Out of which 16 and 18, these strains are a little worrisome, whereas the low risk strains are usually causing genital warts, so they are not that dangerous.
Doctor, how common is HPV?
HPV is a it's a common virus, and HPV is a root cause of various other, we have been talking about genital cancers as the main cause, the HPV being the main cause of cervical cancers, but also we find other cancers as well. So when we are related to HPV, like oral and anal and all that stuff. So this virus is usually through skin to skin contact, and it is quite a common cancer because in India, out of 5, at least 4 women would have been infected by an HPV virus sometime or in their lifetime. But it's not so dangerous because it just says 1 year it remits back to normal. So yeah, it is common.
Alright, doctor. And doctor, who should get the HPV vaccine?
Yeah, since the cause of the cervical cancers, anal cancers, oropharyngeal cancers, and other related cancers, vaginal cancers, are also because of HPV, there is a vaccine. This is caused of virus, so there is a vaccine against this virus, and that's called as HPV vaccines. And usually, girls. That's a suggestion also from WHO and also from our FOXI GCPR and all the advisory committees of the globe, and they say that we have to have the 9 to 14 years girls getting vaccinated with HPV. But nevertheless, if a girl wouldn't have taken up a vaccine during that age, she can actually prolong her thing and she can take it up till the age of say 26 and maybe even little later also till 45. So but usually we have been advocating to take for the girls, school age adolescent girls from 9 to 14 years of age.
And doctor, when should a girl or a child should get vaccinated?
So this vaccine is basically before the prior to the sexual debut is what we say. So that's the reason why this 9 to 14 years of age has been selected. So a girl should be getting vaccinated between 9 to 14 years of age.
Okay, doctor. Doctor, how does a person get the virus, HPV virus?
Yeah, so this is a skin to skin contact virus. So it's actually by the contact basically. So it is a genital skin to genital skin contact, and even handling, those things, touching the genitalias. So this is how exactly the virus has been, you get a virus.
Doctor, how is genital HPV passed from one person to another person?
So genital HPV is usually because of sexual contact. Now the understanding with the genital HPVs are, it is mainly because of it need not have a penetrative sex. So even a genital skin to genital skin contact can also be the causative factor for the HPV transmission.
Okay, doctor. Doctor, what are the symptoms of HPV infection?
Usually these HPV infections are actually symptomless. So even if the lady has it, she won't know it. So they are actually symptomless, and white discharge can be one symptom, but then barely we just can't put them into symptoms for HPV because there are various other causes for white discharge, leukorrhea as well.
Okay, doctor. Doctor, what are genital warts?
So one of the symptoms, as you had asked me, Priya, is for the low risk HPV is warts. So and I mean that these genital warts are due to the low risk strains. Genital warts seldom turns into carcinoma. So these are those overgrowths on the skin which can be found on genital areas. They can also be found in anywhere. It's a very common thing, a warts is a very common thing. You can find it at the nape of the neck or the neck, and even in the other areas. But genital warts are basically pertaining to the genital areas.
Doctor, what types of HPV cause genital warts?
The low risk HPVs from like the strains of 611 and the other low risk factor strains, they are the positive factors for genital warts.
And doctor, how are genital warts treated?
Usually they are left alone, they aren't treated, but if they are causing some hindrance or cosmetically in a cosmetic fashion, if the lady is not finding herself comfortable, then for those reasons they can be treated with laser treatment or with cauterization, or there are those solutions which we put over there like sclerins. In this way the warts can be removed.
Alright. Doctor, when can HPV infection cause cancer?
Now, HPV infection, if they are persistent, so one thing to understand with an HPV infection is not that all the HPVs, even a high risk HPV, not that all the HPV high risk strains are also going to go into cancer. If you have a good immunity power, the HPV which has been actually identified, all the tests which are available in the market for the high risk HPVs, they identify the high risk strains and they identify the HPV infections. But it's not so that these HPVs all are going to get into a cancer. Now HPVs in 1 year they turn back to normal. So there's nothing much to worry. And only when these strains are 16 and 18 and those are the possible carcinogenics. So you in the HPV of a high risk itself, it's divided into possible carcinogens or probable carcinogens. So probable carcinogens are those non-16 and 18 varieties. They seldom turn into cancer, but yes, there are been chances that they have turned into cancer. But if the patient is 16 and 18 positive. Now these are the cases where the probability of getting into cancers are about 70%.
So it's time for a short break. We'll be back in a few minutes. Welcome back to Narikaa Talkshow again. Moving on to our next question. And doctor, how long does it take cervical cancer to develop?
So it usually takes 15 to 20 long years. So there is a prodromal or pre-cancerous conditions where there is an infection with an HPV. The cells are just turning atypical or dysplastic, and we call this as cervical intraepithelial neoplasia, which is called as CIN. And even these CINs also can turn negative, and if detected early can be treated fantastically with the OPD based procedures. But now these are the cases where if it is not detected and they progress into a high grade CIN, this is the time when they turn into cancer. And it takes around usually we say it's 10 to 15 years, sometimes even 20 years.
Alright, doctor. Doctor, how can you protect against HPV infection?
So the one is having a safe sex, that's definitely. Other thing is you can first of all get screened. You will have to get screened. Just can't go without it. Now people say, people have been using condoms and latex condoms and polyurethane condoms, but condoms also, if it is not sheathed properly, there is a skin to skin contact and can have HPV infection. So the best part is to have a safe sex with condoms. And another thing is to get yourself screened, because HPV doesn't have any symptoms. We never know one person had an HPV or not. The partner is suffering from HPV or not.
Okay, doctor. Doctor, what is an HPV vaccine?
So since this cancers are caused because of this virus called as Human Papillomavirus, there has been the vaccines which has been developed to give the immunity or for against this HPV infections. So the vaccines are mainly HPV vaccines are 16 and 18. It is mainly attacking the 16 and 18. Seeing to it that these the future infections doesn't occur, or if the girl has not gone into sexual debut, then she doesn't get these type of infections. So basically these are actually, they are just virus like particles which are called as VLPs, and they do not have any genetic material into it. It's actually made out of the outer coat of the antigenicity is made out of the outer coat of virus like particles. And hence these vaccines are extremely effective because they behave like a virus in the body, and there is an immunity developed against 16, 18 and other high risk types of. Nowadays we do have nonavalent vaccines also, which are giving a resistance or giving a protection against 9 strains of HPV. We did have quadrivalent, which was giving us an immunity protection against 4 strains of HPV.
Alright, doctor. Doctor, what does the HPV vaccine do?
HPV vaccines, as they are virus-like particles, they are actually injected into the body, and they start developing antibodies against these viruses. Now and they protect the future, the upcoming infections. Basically these virus-like particles. Now, why should you take a vaccine is because even though HPV is so common in the country, it's all local infection. It doesn't create that general inflammatory or the protection. So our immunity power with humoral antibodies, they are not developed. Cell mediated antibodies are not developed because it's not a systemic disease. Only if you have a systemic disease like influenza or something else of that sort, then your body reacts to that antigen and creates their own innate immunity or antibodies. But HPV being a local infection, it doesn't give that much of a the body doesn't give that much of an antibody to prevent the future infections. So this HPV vaccines, they are given in the systemic, they are in the circulation, and the body picks up the antigens, which are like virus like particles, and then they develop antibody against these VLPs. So that's how HPV vaccines do help. And then what they happen is the antibodies now which is being developed because of our injections or these vaccines, they go to the site of infections. Probable site of infection is cervix and the other rest of the part, and they prevent the future infections to in fact invade the cells. So even though there is a virus in the body, it is not going to be of any harm, and they will become impotent to create any further changes in the cell. That's how a vaccine helps.
Doctor, when should people get the HPV vaccine?
As I told you, it's already been discussed that it's like from the age of young girls are being given more from the 9 to 14 years, because you give only 2 doses in this case, and they have the highest immunity power. So we actually have to promote the school girls from taking this vaccine, 2 doses 6 months apart.
Okay, doctor. Doctor, how is the HPV vaccine given?
It's given intramuscular at your deltoid region.
And doctor, is the HPV vaccine safe?
It is absolutely safe. We haven't seen any adverse reactions to it as of now. Might be just a soreness or some redness, and I've not seen any. I've been giving since long.
Okay, doctor. Doctor, why is the vaccine often only given to girls?
The girls have the highest immunity power at that age. The immunity which is being developed for against this viruses are actually 100%. And also this is prior to her sexual debut, So she gets the highest protection around 100%. But if this is given, as I told you, can be given till 45, is suppose if a girl didn't take a vaccine and she is now older, should you not give her? We should be giving her. And we give her at 3 doses, but we can give it till 45 years as well. But the immunity or the protection which is got in the older age is around 77 to 80%. So that's the reason we pick up these young girls at this 9 to 14 years of age, and they're getting the 100% protection against the high risk strains of HPV.
What are the side effects of the HPV vaccine?
Side effects are, as I told you, it's quite minimal. Might be just redness, soreness, sometimes syncope. Like for any vaccination, for that matter, if a girl comes empty stomach, she might get a little scared of the vaccines or anything, so a syncopal attack. But these are very, very rare. In fact, I have not seen in this 3 decades of my practice, and I've been giving vaccines since now 2 decades. Since it was so not even 1.5 decades, or because it was introduced and we got it in the country since past to 2010 or 11, and from there on we have been giving these HPV vaccines. I've not seen any reactions to it.
Okay, doctor. So doctor, when the HPV vaccine is given, is the HPV vaccine effective?
Definitely, that's why we are giving it.
And doctor, is the vaccine effective for someone who is already sexually active?
See, now sexually active people would have got the HPV infection. They never know they have it. But the HPV vaccination is going to prevent the future infections, against the future infections. So the present one is to be dealt with, doing a screening and identifying whether they have any dysplastic changes and getting it treated. So it has nothing to do with the present infection. Another thing is sexually active women, they need not check their HPV status. before getting themselves vaccinated, because it's going to be a protection against the future infection.
Doctor, can the HPV vaccination cause an allergic reaction?
Very rarely it has been documented. I haven't seen any in my lifetime.
Alright, thank you doctor for sharing your informative views on it, and I hope this session was really helpful and beneficial to all the lovely viewers out there who are watching. So doctor, before leaving, is there anything else that you would like to share with our viewers?
Yes, I would like to say that don't be scared of getting a vaccine. So it should be that the young girls, the family gets vaccinated. The older women, the mothers, get themselves screened, and the grannies, they try to encourage the youngsters to go for screening and vaccination. Thank you.
Well doctor, that was really a great response, and it means really a lot to us to be with you in a Narikaa Talkshow, and thanks a lot for your precious
Thank you
time.
very much.
Thank you. So we will all see you in next session with another interesting topic. So till then, to all the lovely viewers, stay tuned, stay happy and stay safe.